Alright, hello, my name is Dana and I'm going to be your nurse practitioner seeing you today. What's your name?
Troy. What?
And when's your birthday?
8/12/80.
I am washing my hands really fast before I see you, just to let you know that everything that we talk about today is confidential. Alright, so what brings you in today?
I think I pulled a muscle in my shoulder. Yeah.
The left shoulder?
Yes.
Okay. And what were you doing when the pain started?
I was at the gym lifting.
Okay. Lifting weights?
Yes.
Is there anything that makes your pain better or worse?
Not really.
Okay. Lifting the arm at all? Does it hurt?
It hurts, yeah.
Okay, so lifting arm.
Laying on it.
Laying on it?
Yeah, if I lay on my side, it hurts. My shoulder.
Have you tried any Tylenol or ibuprofen?
I tried a little bit of Tylenol, but it didn't seem to do anything.
Okay. 0 to 10, 10 being the worst. How do you rate your pain right now?
Probably 7.
And what does the pain feel like?
Just like a throbbing, almost like my heart beating it.
Does your pain radiate anywhere?
No.
Alright. Are you allergic to anything that you know of?
No.
Are you taking any medications on a daily basis or as needed?
No.
Including herbal supplements or over-the-counter? I know you said the Tylenol.
Nothing. Yeah, besides that.
Any past medical history that I should be aware of?
No.
And then in terms of family history, do you have anything like arthritis or any shoulder problems like rotator cuff injuries?
Not that I'm aware of.
Okay. And then in terms of your social history, is there anything that you know of that could relate to this at all? Or do you drink alcohol?
Not really, no.
Okay, just like maybe occasionally?
Yeah, weekends.
Okay. What do you drink on the weekends occasionally?
A couple mixed drinks. Anything.
Are you a smoker? Have you ever been?
Nope.
And then any recreational drug use?
No.
I'm just going to ask you a series of questions about some symptoms that you may have forgotten to tell me about. So we're just going to go through those really fast. Have you had any dizziness or lightheadedness at all?
No.
Okay. And besides the shoulder pain, do you have like any arm pain?
No. Just the shoulder.
Any elbow pain? Pain that goes into the hands or the fingers at all?
Nope.
Have you heard any popping noises at all?
No.
Okay. Have you noticed that your heart's racing at times ever?
No.
Okay. And then neck pain, back pain
Nope.
at all with this? All right. Any numbness or tingling that you noticed anywhere? Okay. All right, well, I would like to go on to the physical exam now, if that would be okay with you.
Mm-hmm.
Right now, we're going to start with your neurological exam first, and then we'll progress to your musculoskeletal exam. All right?
Okay.
Let me put my stuff down right here. So in terms of your neuro exam, the first thing that I would like to ask you is to assess your mental status. What's your name?
Troy.
And then do you know where you are today?
Yes.
Where are you at?
New Carlisle.
Yep.
Indiana.
Yep. And then what's the date today?
July 22nd.
Yep.
2019.
Perfect. Now we're going to assess your memory. I'm going to give you 3 words that you have to remember, and that will be your immediate memory that we're testing. So if you're able to remember, I'll ask you about them later. It's going to be cloud, cat, and dog.
Okay.
All right. Next, we're going to assess your recent memory. What did you have for breakfast today?
Cereal.
Okay. And then we're going to test your remote memory next. Where did you grow up?
Port, Indiana.
Okay. So then next, we're going to assess your abstract reasoning skills. When someone says that it's raining cats and dogs, what does that mean?
It's raining really hard.
Yep. Next, we're going to assess your judgment. What would you do if your house was on fire?
Get out.
Very good. The next thing I would like to assess is your general knowledge. Who is the current president?
Donald Trump.
Yep. And then we're going to do some serial calculations to be able to assess your attention span. So if you're able to subtract 2 from 20 all the way until you get to 0.
18, 16, 14, 12, 10, 8, 6, 4, 2, 0.
Very good. Okay, so the next thing that I would like to assess, I'm going to have you stand up and we're going to do the Romberg test. I'm going to have you stand, close your eyes, keep your arms at your side, feet together. Very good. And just stand like that for a few seconds. Very good. That would be a negative finding. I'm going to have you sit down for me again and open your eyes. The next thing that we're going to test is your coordination. So if you're able to just touch your fingers to your thumb. Yep. The next thing we're going to do is some hand slaps. So you're just going to go like this with your hands. Very good. Now I'm going to have you tap your toes on the ground. Very good. Now I'm going to have you run the heel of your foot up and along your shin, just up and down, and then do it on both sides for me. Very good. The next thing that I would like to assess is your accuracy of movement. So I'm going to have you just touch your nose with both hands for me. Now next I'm going to have you take just this hand, and if you can touch your nose to my finger, and I'm going to move my finger around. So touch your nose, touch my finger, and back and forth. Very good. All right, so then the next thing that we're going to test is sensation, and this is going to be sterignosis. I'm going to have you close your eyes, and I'm going to put a familiar object in your hand, and I need you to tell me what it is. So close your eyes, and I'm going to put this in your hand. Feel for it and tell me what it is.
A ring?
He is absolutely right. It is a ring. The next thing that we're going to check is brachysthesia. I'm going to have you close your eyes for me, and I'm going to draw a number in your hand, and I need you to tell me what that number is.
8.
Very good. The next thing that we're going to test is the 2-point discrimination test. Close your eyes for me. This is going to feel like 2. You feel like that's 2? And this is going to be 1. Can you tell the difference?
A little bit.
Okay, well, let's try this.
All right.
1 or 2?
1.
Very good.
2.
Yep.
1. 2. 1. 2. 1. 2.
Nope.
Nope. 1.
Last one was 1. But all the other ones were good. The next thing we're going to do is assess light touch. I'm going to have you close your eyes for me again, and I just want you to tell me where you feel the touch.
My shoulder.
Which one?
Right shoulder. Left forearm. Right hand. Right knee. Left calf. Shin. Right foot. Left big toe.
Good job. The next thing that we're going to do is we're going to test sharp versus dull sensation. So this is going to feel dull. That's going to feel sharp. All right. So close your eyes again and tell me what you feel.
Sharp. Maybe dull.
We'll go with dull.
Dull. Sharp. Dull. Sharp. 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 Dull.
Very good. The next thing that we are going to test is proprioception. So this time I'll also have you close your eyes, but what I'm going to do is lift one of your fingers or one of your toes up or down, and I just need to have you tell me if the movement is upward or downward.
Okay.
All right. So
Down. Up. Up. Down.
very good. Now we're going to assess some vibrations using my tuning fork, and I just need you to tell me if you feel the vibration, okay?
Hmm?
All right.
Yes. 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 Yes.
All right. Very good. So next we're going to get into more of the musculoskeletal aspect. So what I need you to do right now, I need you to stand up for me, and then I just need you to walk so I can just assess your gait. So just let your arms freely swing. Looks very good. Your body looks symmetrical. Now when you come back, stop right there. I'm going to have you tandem walk back to me, heel to toe.
Turn around and do it to you.
You can come this way and do it to me. Oh, not backwards. Turn back around. Yep. Heel to toe. Yep, perfect. And then if you're able to turn back around and go back that way for me. Very good. All right, so the next thing that I'm going to do is I'm going to assess your back. So I'm actually going to have you flex forward. So if you can flex forward for me. With this, is this as far as you're able to go?
I can go further.
Okay, try and go as low as you can go. So when I do this, I'm inspecting your back, and I'm looking at your back. I'm inspecting for any redness, any obvious deformities, lordosis, kyphosis, scoliosis, and with this we do the Adams test, which is basically what he's doing right now. I'm looking at symmetry of the scapula, of the iliac crest, and of the knees, and everything does look symmetrical. While you're doing this, I'm going to palpate your back, and I'm palpating for any redness, any heat, obvious deformities I don't feel, no swelling, any tenderness when I palpate at all?
No, not really.
Okay. Very good. I don't see that you have scoliosis. The next thing that I'm going to actually have you do is if you'll lay down for me, we're going to check you for sciatic nerve pain. And if you were to have pain when I lift your leg, we would note the degree at which you had pain for sciatica. Any pain when I lift your leg up at all?
No.
All right. Stay like this because I'm going to check your plantar reflex next. Negative Babinski. Now you can sit up for me. One part of the neuro exam that I do want to do that we'll do right now, we're going to do your deep tendon reflexes. So right now I'm going to do your biceps, triceps. I'm going to do your brachial radialis. Very good. And then I'm going to do your patellar. Very good. Do your Achilles. Get out of the way here. And then I do not note any clonus at all, which would be involuntary movement. So we are good there. So since we're focusing on left shoulder, correct, for your pain? All right, what I would like to do now is assess your shoulder. So the first thing I'm going to do is I'm going to inspect your shoulder for any redness, deformities, and for symmetry. The next thing I'm going to do is palpate the shoulder. And I'm going to palpate the shoulder for any swelling. Is it tender?
Yeah.
A little bit, sorry. Any heat and any crepitations, which I do not feel. So the next thing I would like to do is we're going to do some movement. It's active range of motion. So if you're able to abduct the arm, adduct, very good. And then you're going to flex upward, back. Are you able to extend back some?
Yeah, a little bit.
And then we want you to do some circumduction. Are you able to do this a little bit?
Yeah.
Is it really painful?
Yeah.
You don't have to keep doing it. The next thing that we're going to do with the arm is this. Keep the arm kind of at the side. Do some internal rotation, external rotation. Very good. The next thing that I would like to assess, we're going to do a couple of tests. The first one is going to be the arm drop test. If you're able to stand up where you're at for me, you're going to lift your arm up right here. And then if you're able to slowly slowly lower the arm. Now if your arm were to drop, then that means that you could have a rotator cuff injury. Which you did all right. The next thing we're going to do the near impingement test. You can sit back down for this one. I'm going to lift your arm up and I'm going to try and feel for any clicks, and I want to know if you have pain when I do this.
Yeah, about there it hurts.
Yeah. How about when right here?
Yeah.
Okay. That also tests for rotator cuff tears and injuries, and that would be suspicious for possibly an issue with the rotator cuff there. The next thing that I am going to assess is your elbow next. So the next thing that we're going to do is I'm going to inspect your elbow for any redness, deformities, and for symmetry, and then I'm going to palpate the elbow. I'm palpating for any tenderness, any heat, any swelling, or crepitations. And I'm also feeling and palpating the epicondyles for golfer's elbow. And for pitcher's elbow, which I don't feel any issues there. So right now you're flexing your arm. Are you able to extend the arm? And then you're going to pronate, supinate. Very good. And now I want you to lift your arm. I'm going to push for testing your strength. Okay, now push, push. Very good. Very good strength on that side. And actually with this arm again, I want to test the strength of the shoulder. If you're able to lift this arm up for me, and I'm going to try and push. All right, push. All right. Still has some decent strength, but probably not as good as what you normally do. And I do not note any abnormalities in the elbow thus far. So the next thing that I'm going to do is I'm going to inspect your wrist. And so I'm inspecting the wrist for any redness, deformities, and for symmetry. Next, I'm going to palpate the wrist, and I'm palpating for any tenderness, heat, crepitations, or swelling. And so now I'm going to have you flex. And you're going to extend. Yep. And then if you could go ulnar, radial deviate. Yep. Radial, ulnar. Yep. Just keep doing that for me. Very good. And then what I'm going to have you do, we're going to assess you for strength. If you're able to come back this way, and then go and come this way. Now push. Yep. Very good. And then the next thing that I'd like to do is we're going to do the Phelan test. And what this test for is for carpal tunnel. So you're going to put your hands together like this and just hold it there for about 20 seconds. We're seeing if there's any pain or tenderness that occurs when you do that. All right, that was about 20 seconds. The next thing that I'm going to do is I'm going to have you hyperextend your wrist like this. I'm going to tap on your median nerve. This is called the Tinel test. And this also tests for carpal tunnel. Any pain or anything in through there? No? Mm-hmm. All right. The next thing that we're going to do is I am going to assess your hands and your fingers. I'm inspecting your hands for any redness, deformities, and for symmetry. I'm now going to palpate your hand for any heat, any tenderness, swelling, and crepitations. And so right now, can you make a fist for me? Put your fingers out and fan them for me. Very good. I'm going to have you squeeze both of my hands for strength. And they do feel equal bilaterally, equal grips. The next thing that we are going to assess is we are going to assess your hips. So if you are able to stand up for me, I'm going to do this part. I'm actually going to come behind you. And then right now I'm just inspecting for any redness, any deformities, and for symmetry. And they do look, for the most part, pretty symmetrical. Next I'm going to palpate for any tenderness, swelling, crepitations, and heat, which I don't feel. I'm going to have you lay down on the bed because we're going to do some range of motion for me. Are you able to lift this leg up? We're going to flex it. Now extend it. Come back and we're going to internally rotate. Externally rotate. Any pain or anything when we do that at all? Okay, we'll do that. And then the next thing that I would like to do, you can actually sit back up for this. Thank you for being a good sport about all these position changes. The next thing that I'm going to assess is your knees. I'm going to inspect your knees for any redness, any deformities, and for symmetry. I'm next going to palpate the knee, and I'm palpating the knee for any heat, tenderness, crepitations, or swelling. Any pain or anything? No. All right. So next we're going to do a series of tests with this as well. I'm going to have you extend, yep, and then flex, yep, very good. And then I'm going to do it against strength. So, yep, and then go back, yep, very good. And then actually, well, we'll do that in a second. What I would like to do is another kind of series of tests. This one's going to be the Lockman's test, and all of these tests for ACL tears. So I lift up, and I don't see anything here. Then I'm going to do the anterior drawer test, then the posterior drawer test, and I don't see any abnormalities at all in through there. And then we're going to do the McMurray's test. So this one, I'm actually going to have you lay back down for. And for this, we extend the leg up. And I'm just feeling in this joint space in through here. We'll do the same thing in through here. Any pain or tenderness at all?
No.
Okay. And actually, one more thing I would like to do in terms of your hips. We didn't test the strength of the hip. So what we got to do is, are you able to move this leg out a little bit? Yep, very good. This is abducting and adducting. Now this way I'm going to push. You push against me. Yep. Same thing with this one. Push against me. Very good. All right, I'm gonna help you back up. Thank you. Getting dizzy?
No.
Good. The next thing that I'm going to assess will be your ankles. And I'm inspecting your ankles for any redness, any deformities and for symmetry, which I don't see. And then I'm going to palpate the ankle, and I'm palpating for any tenderness, any swelling, crepitations, and symmetry. All right, so I'm going to have you flex the foot up, extend it down, testing your range of motion. And I'm going to have you, yep, that's inversion and eversion. Very good. Yep, very good. And now I'm going to actually have you flex your foot up again for me. Test the strength. Now, same thing. Very good. Very good. Now the last thing I would like to do is I'm going to inspect your feet and your toes. And I'm inspecting for any redness, any deformities, and for symmetry. Then I'm going to palpate your feet and toes for any heat, tenderness, any crepitations, and for any swelling, which I don't feel. All right, are you able to kind of clench your toes for me? Yep, very good. Straighten, fan. Very good. Very, very good. All right. One of the last things that I need for you to do, if you're just able to kind of stand for me and just relax, because I just want to see your overall muscles in a relaxed state. Are you able to contract your upper and your lower body for me? Okay. Yep. Now the very, very last thing that I would like to do with you today, I'm going to have you lay back down for me. Promise you it's the last time I'm going to make you lay down and sit back up. You've been a great sport about all this. I'm going to measure you from your iliac crest down to the medial malleolus, and I want to be sure that these are equal. And I would compare with the other side. Which I do feel very equal. All right, I'm going to help you up, especially with that shoulder. Thank you very much. We'll be in touch, and then we'll discuss more about what we got to do to get you feeling better today, okay? Thank you so much. I hope you have a great rest of your day.
You too.
Thank you.